Hello, welcome to the Jean Show. My name's Jean Ramciati. And today the topic of our show is full spectrum light therapy. And I have with me an expert in this area, Dr. Lewis Connor, a longtime friend. Welcome, Lou.
Thank you very much.
So let me tell you a little bit about Dr. Lewis Connor. Dr. Connor is California's leading headache pain relief expert. Why? Because of his headache relief techniques and the ability to rapidly decrease and remove headaches. Dr. Connor has administered over 150,000 treatments to chiropractic patients over the last 32 years. He has been in practice right here on the peninsula. Currently, he is clinic director of the Menlo Park Pain Relief Center in Menlo Park, California, and he specializes in treating families, athletes, and professional entertainers. Dr. Connor was the treating chiropractor for Cirque du Soleil for 8 years. Plus, he has treated many performers such as Pink Floyd, Bon Jovi, Dwight Yoakam, just to name a few. I'm fortunate to have been his patient for 20 years. Dr. Connor uses applied kinesiology, which is a chiropractic muscle function and strengthening technique, as one of his many techniques to diagnose and treat. Plus, he uses full spectrum light therapy to help his patients become pain-free. I'm anxious to hear all about this, Lou.
Okay.
Tell me, what do you do that is so effective?
The body knows how to heal itself. If we cut ourselves, we heal. We don't have to think about it. It's when there's a blockage that happens in that healing. Our job is to release that blockage and let the body naturally heal itself.
Wow, that's amazing. So what exactly is full spectrum light therapy and how does it work?
We say full spectrum because it goes between red light and infrared light. Each has a different function, and when matched up with a frequency, will create an effect. The red light spectrum goes into the body about 8 to 10 millimeters, where the infrared will penetrate 20 to 100.
Oh my gosh. Wow.
Now, when we match that using the frequencies with the penetration, what it does to the body is it triggers off in the cell, there's a little thing called the mitochondria. That's what produces energy for our body. It stimulates the mitochondria to produce more energy. In that, it also assists in releasing nitrous oxide into the body. When that happens, then there's a greater blood flow. When there's a greater blood flow, there's more oxygen being delivered to the cells. So more oxygen, a healthier cell brings about a change in the body, so we get some pretty dramatic changes.
Well, what's the machine like? Or, you have an example here of the machine, right?
Yes. Well, first, there's two ways that this can help. Each one of these pads has 200 little lights in it. So the pad is put on the body. You can put 3 pads together, and you can use another 3 pads, so you can be healing 2 parts of the body at the same time. The machine is called or produced by a man who created it, a brilliant man, Dan Schell. And the machine is called Light MD, like MD for medical device. So he, in his brilliance, figured out, okay, let's match up the different colors with the different frequencies to create an amazing result.
Wow. And when did this happen? I mean, when did he discover this? Bring it to fruition.
Energy or electrical energy has been, since the turn of the century. Wilhelm Reich was a German. He figured out that there was different frequencies that would heal different problems within the body. And so he applied those frequencies and got amazing results. Dan then took that and added the light into it, so now you have light plus the frequency to create the amazing results.
Wow. Do you want to show us a sample of this? So this is the magical machine, right?
This is what it looks like, and this is what a pad looks like when it has the red light
Oh my
going.
gosh.
So it's quite bright, and the red light, as I said, enters into the body and starts triggering off pretty rapid healing.
Can I see it again? Oh my gosh.
Sure.
Wow. So how long do these, is that what you call them, plates?
Okay, yes.
How long do these plates stay on a person? Or how long is the treatment, in other words?
The treatment is 20, the machine is set up to turn on and off after 20 minutes.
And that is because you don't want too much at one time, or what?
No, actually, when the healing started happening, it was suggested 20 minutes every other day.
Oh.
What we've discovered is that when you put treatments back to back, so now you have 3, 4 treatments in a row, the healing happens a whole lot quicker and a whole lot faster and much more effective. So rather than doing 20 minutes now, we found that multiple treatments following each other will be much more effective.
And there's no fear of getting burned or anything, right? Or, I mean, this is so new. I mean,
No. The people will complain about, oh, it's hot, but it's not the pad that gets hot. It's because what this does is trigger the cellular changes to happen 150 times their normal rate. So whenever you have movement, you have heat generated. So the patient will say, oh, that's getting a little hot. Well, then we'll remove it or put it into a different area because the body is heating up. And you go feel the pad.
So the
pad is just
pad
warm.
isn't hot.
Yeah, it's not the pad that's getting too hot.
My gosh. So, it's really something.
Yeah.
Well, why hasn't this come out sooner? Or has it been used at all up to this point? Or?
Yes, light therapy has been used for a long time. Electrical therapy has been used for a long time. Laser has been used for a time. This particular machine, because there's so many lights and so much that the body is absorbing. See, if I took a bunch of cells off took a piece of meat off my arm, there's a whole bunch of cells there. How do they communicate with each other? By light, a little thing called a biophoton. So that's how cells talk to each other. The nervous system sends a signal out to the muscle and tells the muscle what to do. But the cells will talk to each other by light. So in using the light therapy, you're getting some amazing results. I had a patient who, now, for me, when I first looked at it, I thought, I want to be able to have people get out of pain quick, because that's why they come to me. What this does is pain relief real quickly. I had a patient who couldn't, when I found out, he said, I haven't been sleeping more than an hour for 3 weeks because there was such intense pain coming down his arm and the last 3 fingers were totally numb. 10 treatments, pain was totally gone. I had a patient come in because I had mentioned the machine. She said, root canal. And I went, huh? Just, well, if I put in hot or cold into my mouth, it hurts. So I went to the dentist and he said, you need a root canal. 8 treatments, cleared it up, because not only does pain relief, it stimulates the body to remove infections or inflammations. Because that's the first thing you want to get rid of when you have an ouch or an injury. Let's get rid of the inflammation, because the inflammation goes in there. The longer the inflammation stays there, the longer there's going to be pain and a problem.
So if the pads are on you, it's healing everything that's under it. It could heal the skin. It could heal the hurt. Is that true? Whatever is under that pad is being affected.
Correct.
Right.
How I learned about it was a friend told me about this horse who, now in a horse, suspensory ligament is this one right here. It had a 3.5-inch by 1/4 inch tear in the ligament. Now, ligaments, they don't heal by themselves. 20 minutes a day for 3 days a week for 9 weeks, and that totally grew new ligament tissue. I mean, something basically unheard of before. So it stimulates the body. As you know, after 7 years from today, I won't have the same cells that I have in my body now. Because cells, they go through a life and death cycle.
Oh my God.
What this does is speed up that cycle. So the cells that are now replicating are replicating themselves stronger than they would normally.
Well, I know you have this wonderful story about your friend who had Parkinson's. You want to share that story? That just
Sure.
amazes
My
me.
wife and we have some dear friends out in Utah. My wife and I went out to be able to, because I was getting amazing results with this, I thought, what can we do for Don? I had no idea what was going to happen. I just wanted to give him some relief, hopefully stimulate something in his body.
And he was in bad shape, right? He couldn't
He
stand.
couldn't get out of bed by himself. Walking, he'd have to hold on to somebody and shuffle. Eating was a bib, getting his food cut into tiny pieces, and when he got done eating, there was food all over the place. His wife said to me, I haven't had a conversation with him for 6 months. That's how he was talking, and drooling a lot. So we got there on a Saturday. I treated him 5 times on Saturday, 14 times Sunday, 15 times Monday. Monday night, his wife said to me, Tuesday morning, my wife said to me, I had a conversation with him last night. First time I've been able to understand him in months. And then another 7 times on Tuesday. She also said, we haven't been out to eat with anybody in 8 months because it's embarrassing. Tuesday afternoon, Don said, can we go out to dinner? We went out to dinner, and he had a normal-sized piece of fish on his fork. When he got done eating, there wasn't all the food all over the place. He was able to get up out of the chair and leave and walk normally, getting out to his car. When we got back to the house, there's 3 steps going up into the house. We helped him out of because he could get one leg out of the car by that time. We helped him out of the car. He walked up those steps by himself, opened the door, went in. Where when we had first gotten there, she had to hold on to him, walk up backwards while I was helping lift up his legs to get up the steps.
Oh my gosh! And he's continued to get better, right?
So much so that we can talk to him now on the phone and understand him.
Oh my God!
Continued, yes.
Wow.
Yeah, I never expected that. I didn't know what we're going to end up with, but the phenomenal results were.
And now, so you put those pads, all six of them, like all over his body, or would you change the areas? Or tell me what you did.
3 pads I put over his head.
Okay.
Because in Parkinson, it's a central nervous system problem. So I thought, why not stimulate his
Start
brain
there.
and his central nervous system? And then I would put over his heart and lungs. I put over his intestines. We put over his back for his back pain. He couldn't, his hand was like that when we got there. We could force it open, but he couldn't pick up something. You know, he could, if he wanted to hold on something, it would be like that. And he couldn't raise his arm very far. When we left, he could raise his arm, and his hand was starting to open. He had this big hematoma. It was black here. By the time we left, that blackness, 60% had gone away, and you could see skin before. Where when we got there, his skin was very thin and taut. You could almost see through it. It didn't have the. When we left, his skin colorization and his eyes. When we got there, his eyes were very closed and sort of a spacey looking feeling. When we left, his eyes were open. He was alert, being able to respond to what was going on. It was just an amazing experience that I just did not expect to.
Oh my God. Oh, and his wife must be so thrilled.
Oh yeah. She said, "Thanks, you're giving me my husband back."
Oh my God. Now, did you document this, or have you written it up, or sent it to the Parkinson?
I haven't done that yet.
Society.
I've written it up in an article
okay.
to be published.
Okay.
And we're in process now of contacting Parkinson's.
That's amazing.
Now, it's an odd one for me because I can't, as a chiropractor, treat a disease.
Yeah, right. Yeah.
I don't go there to treat it. I look at, okay, how can I help the muscular system get the person out of pain, help the muscular system to start work better, and give them more flexibility and more dignity in their life. That's what's going on for Don. I mean,
Now, so when you're treating him, you put the pads on for 20 minutes. Oh, it's always 20 minutes, right? And
well, the
there's a
machine will shut
break.
off after 20 minutes.
Oh, okay.
Then I just hit it and
Oh, I see.
reset it.
Okay, okay.
And
So
it goes
the
on for another
machine,
20 minutes.
20
and I
minutes cycles,
so every
okay.
20 minutes, I'll just reset
Okay.
the machine so that we'll have continuation of treatment.
Well, that's a very...
Given that I didn't know when I went out there how much the body could take, we would do it, and I just keep asking them, "Are we okay? Yeah. We okay? Okay. Yeah, it's getting a little hot here," so I'd move it to another area. We okay? So we just kept checking with him. I never expected to do 14, 15 treatments in the course of a day. I didn't know what his body was going to be able to take.
Well, I know that this is your most dramatic case, but you have some other stories of people who you've helped heal. What are some of the other ones?
Back pain,
Back pain.
lower back pain.
And you said even depression, right?
Yes.
Some depression. Well, I would imagine if somebody starts to feel better, it helps their depression, right?
Absolutely. Absolutely. And that was I didn't know, again, what kind of results. I don't, okay, well, depression, let's look at something's going on mentally.
Okay.
Is there a blood flow problem that we can help stimulate? Is it an energy problem? So to be able to increase somebody's energy is going to be able to take them out of depression. Now, another thing you could do simply, I mean, if you put your head down like this, is it easier or harder to breathe? It's harder to breathe. You bring your head up like this, tilt your head back and look at the ceiling and smile, you're going to have a whole different experience of yourself.
Yeah.
So in working with this patient, it was, okay, let's see what's going to happen. And she was totally up for it. And her husband said, what the most dramatic thing that's happened is she doesn't get as mad quickly. She doesn't hold on to it for as long. She realizes what's going on for herself and stops that whole...
Yeah. So it even helps heal emotions, a nice, a wonderful side effect or maybe a goal. But tell me, is this happening all over the United States or the world, or is it just coming out?
There are a lot of machines out there now. If you went on eBay, you could see a lot of different light machines. I've looked at a bunch of them, and none that I've seen have as many lights. And they have most of them are set on one frequency. They don't change the frequency to be able to work with whatever the problem is.
Oh yeah, and you know what? And you change the frequency for every special disease, right? You have some kind of a chart or something, don't you?
For every challenge that the body has, there's a specific light and frequency that's going to assist that part of the body to be able to operate as close to 100%
So
a
it's
kid.
not like you just have one light and then it goes the same. Light goes into every person. It's different for every thing that you're trying to address, right?
Well, there's two things that happen.
Okay.
Yes to that question, and also program into the 20 minutes, it's not just one frequency. The frequency changes every few minutes. That depends on what one it is. Some last for just 2 minutes, some last for 3 or 4 minutes, some last for 5 or 6 minutes.
Okay.
But it's constantly changing. So you'll see it'll be red light, and then it'll blink, and then the red light will come on. It'll be a blink again, and maybe you won't see any light, because in the ultraviolet or the infrared, you don't see color. So it constantly is changing.
To me, that sounds like that's what's really good about it. It's specific. It's just not the same thing for every person.
Correct.
That's
Correct.
really
That's
good.
what we want to look at, is because if it can regenerate ligament tissue, I mean, I have a video, one of the doctors that has it just treats animals. And there's this little chihuahua that's sitting there on its butt with its front legs out like this, and they lift up the hind and let go and just falls down. He pulls himself along by his front paws. 4 treatments later, and that dog is running around the office like nothing ever happened.
I've seen that video. It's unbelievable.
Yeah, it's pretty
that
amazing.
Video. So,
Yeah.
if they've been using it on animals, why haven't they? Why hasn't this been more known about and tried sooner on humans?
The research on something like this to be able to get FDA approved, which it is FDA approved now, is done. There's a MD that has a machine down in San Jose, and there's a couple chiropractors that have been doing a lot of research with patients to say, okay, what's the best that we can do to be help them with this specific situation, which has opened up a lot of information. Now, the potential is exponential of what can be worked on. I mean, anywhere from wrinkles to growing hair to helping the body become more muscular or definitely healing. That's
why I can't
wide
believe
open.
Where has it been? But anyway, how can people contact you or find out more about this?
You could call me at 650-281-8815, or you could go to my website, which is www.drlewiseconnor.com.
Good. So now we got that.
Yeah.
That's really good. That's what I'm saying is like, and it could also become addictive, right? I mean, if people start to feel better, they just want more and more of it, right?
That's the hope.
Oh, that's the hope.
Because some people come in and I'll ask them the question, what do you want? Do you want to fix the challenge that you're having with your body, or do you just want pain relief? Some people say, I just want pain relief.
Pain relief.
In 32 years, I've had maybe this many people come in and say, Doc, I feel great. I want to stay that way. Can I see it once in a while? Everybody else comes in because they're in pain.
Yeah, right. That makes sense. Oh, my gosh. This is, I think it's like miraculous.
Yes, definitely. The experiences that I'm having are so phenomenal. I would say yes, they are miraculous. They are little miracles that happen. Because how does, when I looked at it, how does this really happen? There's so much that's going on in the body. There's so much potential to tap into with finding the different frequencies matched with the different light to be able to create what we want to, the results that the patient wants to have.
Well, can you believe it? We're almost out of time. I've learned so much already, but what would be some profound things that you'd like to leave with the people watching, like your philosophy or your theory about healing? let's do a little wrap up here.
A patient one time, when I asked, what do you want? They said to me, well, you know, I'm 85 and I've had a great life. Just get rid of pain, because I can check out any time and I'm fine with that. And it got me thinking, what do I want with my life? What I realized was I want to live to 120. And I want to be, like I am now, being able to do stuff and be effective. With that came the responsibility of I have to eat good. I have to go to the gym 3 times a week. I go to my naturopath. I go to my chiropractor, get adjusted twice a week. I have to do something for myself to be able to make sure my body keeps operating at its peak performance. That's what everybody has to decide for themselves. Once they make the decision of, yes, here's how long I want to live, they're going to have to do some stuff to get there. If they don't, their body's going to wear out quicker and they're out of here. We're the only ones that can take care of our own bodies. If we don't, where are you going to live when it wears out?
That's right. That's the truth. Wow. I bet you're just delighted about all this, and it must feel great to make all these people feel so happy.
Yes, that's definitely one of the benefits, to be able to have such incredible results.
I've had the treatment, and I had chronic sinusitis, you know, gone after, you know, a couple of those wonderful treatments. So I can speak for it.
Yeah, very effective, very effective.
Well, thank you. You've been such a wonderful gift to the world that I just want to say thank you, Dr. Lewis Connor.
Thank you for having me.
People can follow you up with the contact information.
Absolutely.
And I'll see you soon.
It's a deal. Thank you, Jean.
So thank you for filling us in on full light therapy, full spectrum light therapy. So thank you for tuning in to my show, The Jean Show, and I'll see you again. Good health, peace.